Thank you, Mr. Deputy Speaker. I agree with my honourable friend. I want to congratulate my honourable friend, the member for Brent Central, on securing the debate and on the way she opened it. I want to focus on one specific point. The Public Health England review says this, and I quote, "People of BAME groups are also more likely than people of white British ethnicity to be born abroad, which means they may face additional barriers in accessing services." And I want to highlight one barrier in particular, and that is the no recourse to public funds restriction on leave to remain, which has already been touched on in this debate. So we're talking about families who've got leave to remain in the UK, who are law-abiding and hard-working, very often with children who've been born in the UK, children who may well be British nationals, have British passports. Typically, they're on a 10-year route to securing indefinite leave to remain, and in the meantime they have to apply 4 times. They get 2.5 years leave to remain each time, and throughout that 10-year period, when they're working here, working typically very hard, doing exactly the kind of jobs we've been talking about in this debate, they have no recourse to public funds. And that is a formidable barrier that those people face, exactly of the kind that the Public Health England report refers to. I asked the Prime Minister yesterday about this, and I asked him about it at the Liaison Committee 3 weeks ago. And his answer on that occasion was that hard-working families in that position should have help of one kind or another. I absolutely agree. Unfortunately, he didn't say that when I asked him about it yesterday, but it is what he said to me at the Liaison Committee. He was absolutely right on that occasion. The problem is those families are not getting that help. I think it comes as a bit of a shock to a lot of people to learn that children of the kind that I've talked about, have been born in the UK, may well be British nationals, their parents cannot claim child benefit for them because no recourse to public funds excludes that. And the families cannot apply for universal credit. They cannot access the safety net, which so many other people have had to depend on during this crisis. 2 million additional people are claiming universal credit since the beginning of the crisis. But that safety net that so many have had to rely on is not there for people who have no recourse to public funds. That has created a very serious problem of destitution. A huge increase in food bank demand in many parts of the country, and in my area, the return of something I never thought we would see, the return of soup kitchens, where people are handing out free cooked food just to keep people alive. I give way to my honourable friend.
My right honourable friend raises a very important point, very pertinent in our London constituencies particularly, because no recourse to public funds means no housing benefit, and it's impossible pretty much to rent privately on a low wage, or even quite a good wage, in my constituency. Doesn't he agree that this underlines how this policy is now out of date?
I absolutely do agree, and I'm grateful to my Lord friend for making that point. How many people are there in this situation? Well, the Home Office doesn't know how many people it's given this status to, and it refuses to answer even the most basic questions on this subject. So I asked, last month, I asked the Home Office a written parliamentary question: how many people were given leave to remain with no recourse to public funds in 2019? I received the reply on the 20th of May, which I'll read to the House. "The information you have requested is not assured to the standard required by the Office for National Statistics for publication, and as it would be too costly to do so, we are unable to provide it." Well, in other words, we're not going to bother answering the question. I've asked the UK Statistics Authority what they make of that answer and the attempt to hide behind the Office for National Statistics, and I'm looking forward to receiving the Chair's reply, I believe, quite shortly. But fortunately, the Children's Society has made an estimate drawing on work of the Migration Observatory at the University of Oxford, their estimate is that at least 1 million people in the UK have leave to remain, but no recourse to public funds, including over 100,000 children. I think most people in this situation are overseas students who've got leave to remain, leave to study, but no recourse to public funds. And I must just raise the question, is it really right that we want to completely abandon those who've, in many cases, at great sacrifice to themselves and their families, come to the UK to study? They've been supporting themselves through working, their work has stopped. They've got absolutely nothing, and they are depending on the soup kitchens that I've referred to. There is a form on gov.uk that appeared on the 3rd of April, allowing people to apply to be exempted from no recourse to public funds. The Home Office refuses to answer questions about how many people have applied, how long it's taking them to answer those applications, what proportion of the applications are successful. But from the experience of my constituents, it seems to be taking between 2 and 2.5 months to respond to applications to be exempted from no recourse to public funds. Now, Mr. Deputy Speaker, if you are destitute, you cannot be expected to wait for a couple of months until a struggling government department gets around to deciding whether you might be able to get some help or not. And I've had one person in touch with me who's been waiting since the middle of February for an answer. As we've already been reminded by my honourable friend, some people have had to carry on working during this crisis who should not have done for their own sake and for the wider public health sake, but they've had no alternative because it was the only way they've been able to achieve any sort of income. And what would any member of this House have done in that circumstance with no money at all? I do want to pay tribute, finally, Mr. Deputy Speaker, to organisations in my constituency who've been helping. Bonnie Downs Baptist Church, Bonnie Downs Community Association, which is a long-standing food bank, which has had a massive increase in demand. The Ibrahim Mosque, the Malayali Association UK, representing people from South India, London, Tamil Sangam, my friend and colleague Councillor Lakshmi Shah, who's been supporting single-handedly, I think, several dozen families in this position. The no recourse to public funds restriction must be suspended for the duration of this crisis.
Yeah.